I have the great pleasure now of being joined by Dr. Jay Talwalkar, giving the state-of-the-art lecture on the management of liver disease and the Affordable Care Act, and really the impact of the Affordable Care Act on care of patients with liver disease is changing as we speak.
It is. You know, in the 5 or so years since the Affordable Care Act was approved, the efforts have really been focused on health insurance coverage through the exchanges and employers, and that's really now come to fruition. Now the focus is on the second part of the act, which is delivery system reform. And primarily, a lot of the initiatives have been focused on primary care and less so on specialty care, but that day is now coming.
And so I think there is a sense of anxiety, maybe a little bit of a fear of how to navigate through, given that the focus is now going to be on specialty care.
Yeah, and I think the reality for specialists, including hepatologists as well as GI physicians, is with the repeal of the Sustained Growth Act, or the SGR, that really set forward the ability to now initiate the implementation of alternative payment models as part of this policy now known as MACRA.
Now, hepatologists are used to dealing with some of these alternative payment models, so perhaps it will not be as much of a shock to them?
So transplant hepatologists have been living sort of in a capitated or alternative payment world for years now through liver transplantation. So most of that care really looks like a bundled payment, and you risk adjust and manage accordingly. I think for other non-transplant situations, then that's going to be a new thing for physicians to have to deal with.
And one of the things that they'll have to kind of get through is the difference between the government insurance and the commercial insurance.
Yeah, most of the innovation right now in alternative payment models is through CMS, which is Medicare and Medicaid, and most of that is for people with government insurance. The commercial insurance plans right now are sort of closely monitoring and following, not necessarily creating their own payment models that differ, but waiting to kind of see how these pilot initiatives go for CMS and how that might change the landscape of health insurance.
Let's talk about certain patient populations, because clearly the encouragement is to get tested for hepatitis C, get treatment for it. And so is there going to be a tremendous amount of out-of-pocket for people, and might that dissuade them then from coming forward and doing what the physicians would like them to do? Yeah,
so the newer insurances through the exchanges or the employers are primarily commercial based or for younger people, so typically ages less than 65. Those plans are affordable, but they have very high very high out-of-pocket costs. And so that can affect access to actually seeing a doctor, getting testing done, coming up with a diagnosis. For Medicare patients, Medicaid patients, screening for hepatitis C and having that evaluation done may be less of a burden in terms of their own personal budgets. Drug costs are a completely separate thing. So at the moment, really governments and other third-party payers aren't able to really negotiate drug prices extensively. We have some examples with the VA. Other countries have been able to negotiate because it's part of their government's charter, but in the US, Medicare, for example, has not yet been given authority to do that. So it's sort of two separate things, but for a particular patient, it's still an issue in terms of cost, but really for the drugs rather than the evaluation.
So for this rapidly changing arena, do you have any advice for physicians?
I think the opportunity now is to help inform people that are developing these models to sort of understand what it is that we do day to day and what it is about our practices that really would be amenable to some of the alternate payment strategies. It very well may be that some of the things we do should remain fee-for-service, but linked to quality or linked to some sort of value measurement. So I think time will tell, but that information will come, I think, from our society and our professionals, because right now there's nobody, I think, in those spaces that are able to inform policymakers.
Well, Dr. Talwalkar, thank you so much for sharing your knowledge.
Yeah, happy to be here. Thank you.